Good morning, Commissioner. Thank you for being here and your testimony. I've got a couple questions that I think many of my colleagues are interested in, so I may not get to them, of course, dealing with the pandemic, among other things. But the first one that really just piqued my interest right now, you mentioned that you've created a new unit or department. I forget exactly how you said it, relating to gun violence. Could you tell me how is it that gun violence fits under the Department of Health? And you were talking about strategies to help prevent gun violence. Like, what do you intend to do with that?
Thanks very much for that question, Senator. It's called the Office of Gun Violence Prevention, and I had the pleasure of meeting its director, who will be joining us quite soon. Her name is Gallivan Thomas. Gun violence is considered a public health issue because it ends life prematurely. And anything that affects the ability to live a long and healthy life, we should be interested in from the point of view of public health. It is also something that we can understand from a population perspective, and it is something that we can prevent by identifying people at risk for gun violence, intervening with them, and in particular, ending cycles of retaliatory violence. So this office, which will be working closely with the criminal justice system, will be focused on data collection, convening, and seeking to bring together the many agencies that are involved with the problem of gun violence. As you know, and I haven't run through the statistics, we have had an escalation in gun violence fatalities during the pandemic. It occurs all over the state, in urban and rural areas, and typically it cuts short the lives, particularly of young men. So this is the goal of this new office. It is to bring the perspective of prevention to gun violence and to collaborate across agencies, bringing public health lens to criminal justice and collaborating with these agencies.
How much money is dedicated to this in the budget proposal?
There's $500,000 in the budget. It will support three lines. So the role of this office is more, a coordinating, collaborating, convening role. And then there's additionally, we will bring the data to bear that help us understand the patterns of gun violence across the state.
Thanks. The budget includes funding for COLA, 5.4% COLA increase for the home care workers, but specifically the health home care managers. I'm wondering if you can clarify who exactly is covered. Clearly, those under the auspice of OMH and OPWDD are eligible for this COLA, but my specific question is, are home health care managers under the auspice of the Department of Health eligible for this?
That's a good question, and I'm not sure of the answer to it. I should ask our Medicaid director, and please.
Yes. Thank you, Senator, for that question. Currently, we're examining whether health homes should receive the same 5.4% COLA that mental hygiene workers are receiving as part of the budget increase. Health homes, as well as a few other programs, including health homes serving children, as well as what are called Article 29I voluntary foster agency providers, are these hybrid cross-system agencies. They fall currently under the auspices of the Department of Health rather than the Office of Mental Health or another mental hygiene agency. And so currently as structured, the COLA would not apply to them.
All right, thank you. The last question, you testified a little bit to the governor's proposal to address the healthcare workforce shortage, and we welcome your efforts in addressing that. But the proposals seem to be long-term solutions. How will these proposals help people right now, the various healthcare providers?
Well, you know about the set aside of $1.2 billion to support bonuses up to $3,000 for individuals who work full-time and for a year. So that we believe will provide needed financial infusion, particularly to low-wage workers who will constitute the bulk of beneficiaries of the bonus program. So that's one effort. Additionally, there are a range of educational efforts that I don't think will take that long to have an impact on the workforce. We mentioned the doctors across New York, the nurses across New York, those will, bear fruit in just a couple of years. We also have put in place a new entity called the Office of Workforce Innovation, which will be funded with I believe it's $20 million. We get 10 additional lines. Will help us have for the first time a sort of one-stop shop for that will have input on training opportunities, educational opportunities, employment opportunities that will enable individuals to match with these opportunities. We'll be building this as a portal that will receive input on its content from labor, employers, educational institutions. So that's an additional way in which we can match people with opportunities.
And just
Thanks, Commissioner. My time is up, but I hope.
Yeah.
Oh, sorry.
Just one point to add on to there too is that Dr. Bassett mentioned in her testimony the 1.5% restoration of the 1.5% across the board, a cut that was taken 2 years ago, plus a 1% increase. As noted in the State of the State address, the governor intends those funds to go towards workforce relief specifically. And that's about $440 million state share a year going right into wage relief across the board for providers. Just want to make sure that's clear. Yep.
All right. Thank you.